It's considered an enormous public health problem, with hundreds of thousands of Americans experiencing one every year. But despite the prevalence, researchers at Northwestern University say over the past 10 years, 1 in 10 strokes goes misdiagnosed. I'm Lee Zurich.
And I'm Tisha Powell. In many cases, a patient's mild, nonspecific symptoms, such as headache, vertigo, or the inability to answer questions, can prompt a misdiagnosis and lead to serious health consequences. Investigative reporter Sierra Cummings uncovers how missed symptoms and delayed treatment resulted in irreversible brain damage for a young Georgia man and heartbreak for his family.
We do work really hard to keep at least 2 months ahead.
Jack Buckelew gives us a tour of his garage.
And as you can see,
not just any supplies,
it's a lot of stuff.
An inventory of life-saving medical tools.
We created an ICU, honestly.
For his son, Jonathan. October 2015, during a chiropractic appointment, Jonathan became dizzy and disoriented, over time becoming less responsive. He was rushed to North Fulton Hospital's emergency room. There, 2 doctors missed key signs, failing to properly diagnose him. A court found the 2 doctors, an ER physician and a radiologist, were grossly negligent. That the ER doctor did not mention to the consulting neurologist Jonathan had seen a chiropractor earlier, that he experienced a second seizure-like event, and that the radiologist missed information on a scan. The chiropractor, the hospital, and other clinical staff were not found liable in this case. But Jonathan was having a stroke, one that went undiagnosed and untreated for 12 hours. It was nearly a decade ago, but ever since, Jonathan lives like this.
You count on hospitals, you count on emergency rooms, you count on specialists, you count on tests, you count on all of this stuff. And treatments never really came until way, way, way too late.
As a result, he now has locked-in syndrome, a neurological disorder where a person is conscious and aware but unable to move or speak due to complete paralysis of nearly all muscles except the eyes.
Just a lot of pain. It's in spite of his spirit, which keeps us going, because he wants to do things, he wants to go places, it just breaks our heart to see him like he is.
Jonathan is an adult, but even at 34 years old, his family and team of nurses care for him 24/7. He cannot talk, but he can communicate by blinking and using his nose to type on a keypad.
There's some days where he's like, pull the plug. So those are the tough days.
But this day is not like that.
Hi, Jonathan.
Mom says Jonathan wants to engage with us.
Did you like the orange chicken? Oh.
One blink means yes.
He is fun. The nurses really love John.
We love Jonathan.
They all say he's just the best
the
to work for.
This is Jonathan's exercise room.
Their entire home reconfigured to accommodate Jonathan's needs, from his bedroom to the physical therapy area to the main living space, which includes his favorite spot, in front of the fish tank, mesmerized by the motion. Expenses covered by what Jonathan's attorney says is one of the largest ER malpractice verdicts in Georgia history.
Jonathan was having a stroke when he came to the hospital, and they missed it. The ER doctor saw that this patient was having all these signs and symptoms of stroke and never called a stroke alert. They didn't follow their policies and procedures.
A jury agreed, awarding the family $75 million. When the ER doctor appealed, an appellate court affirmed the ruling against him.
We know that doctors are going to make mistakes. So it's critical that the hospital develop policies and procedures and protocols that will mitigate or reduce those mistakes.
30 to 50% of the time, minor strokes are currently missed, according to Johns Hopkins research. That same data found overall, diagnostic errors, known as any missed, incorrect, or delayed diagnosis, affect 12 million Americans, 1/3 of people medically harmed as a result. People like Jonathan, who once played nearly every sport, always active, but now his body may never move on its own again.
I really feel like there's no real justice for somebody who lost everything. For the most part, lost every aspect of his life. I guess it's way past the anger, and the frustration. Just really focusing on, what can we do? How can we keep him as happy as possible? How can we give him the best life possible?
The ER physician filed an appeal with the Georgia Supreme Court, but in June 2025, Georgia's highest court decided not to review the appeal's decision, so the lower court's decision remains, and this case cannot be appealed to the Georgia Supreme Court again. At the time of this incident, North Fulton Hospital was owned by Tenet Healthcare. Tenet Healthcare did not respond to requests for comment. However, the company was found not liable.
And remember, be fast to check for signs of stroke. B for balance, whether it's dizziness or not being able to walk. E is for eyes. Is there blurred or double vision? F stands for facial drooping, while A is for arm numbness. S means to check for slurred speech or confusion. And T is time. Call 911 if you notice these symptoms.